I'm Madida Malaji, the regional chairperson of DENOSA.
My name is Ishmael Chabalala. I'm the acting operational manager of Sekuruwe Clinic in Waterberg District.
Anglo-Plat has donated this infrastructure. They were able to build this clinic in terms of our specification, as we had, the community also has taken an initiative to make that request. But then, of course, as a department, we have been able now to resource the clinic in terms of the equipment that are needed, in terms of human resources to get our nurses. So today we are officially operationalization of this particular clinic, because it was just a building. It can only be a clinic when you start to have medical equipment, when you start to have the staff. So today we are here to say to the community of Sekuruwe, here is your clinic now. It's going to be operating 7 days a week, and after that we are going to continue to work hard. Once our posts have been approved with Treasury, we'll be able to appoint extra nurses who will then be able to assist for the clinic to run 24 hours. But I've seen that we are working with our unions. There are representative of DENOSA here, the representative of NEHAU is here, and the representative of Hospesa is here, together with these big unions that are representing nurses within our Department of Health. We are going to make sure that the next time I come here, this clinic will be working 24 hours. So we're going to count from 3, 2, 1.
MEC of Health, Dr Phophi Ramathuba, Concert Musina of Anglo Platinum and other dignitaries, inspects the readiness of the clinic, and they were satisfied.
Okay. Wow. At least you even have a let's clap them for you. This thing was not locked.
I saw that.
This thing was not locked, meaning
You just
if I want to fill medicine, I can fill. Oh, the problem is when you have a chart, so this thing is easier to open.
Constant Musina of Anglo Platinum highlighted the importance of government, business and community partnership in the quest of providing health care as a basic human right to all.
We are honored here today to have our MEC to come and witness the functioning of the clinic. The Sekuruwe Clinic is a social and labor plan project in partnership between Anglo-American Platinum, the Department of Mineral Resource and Energy, and the Department of Health. Anglo-American Platinum supports health care services and underserviced rural areas. It focuses on innovation and partnership to improve access to health. The Sekuruwe Clinic was officially handed over on the 8th of December 2017. The beneficiaries of the clinic are not limited to the residents of Sekuruwe only, but to the nearby communities. We've got Sekuruwe with estimation population of 8,000. We've got Millennium Park with population of estimation of 3,000. We've got Rawela Village with a population of 5,000. We've got Hamulikana with an estimation of 2,000, and we've got the Rapuka and the Rasekaulelo combined with a population of 3,000, which brings the total beneficiaries of 21,000. The clinic is big, it's almost 608 square meters, and we also have on-site staff accommodation, which is 450 square meters. We are happy today, MEC, as our partner, when you are honoring the agreement that we initially agreed upon by staffing and also fully furnishing the clinic. The clinic has a maternity facility that will care for the communities of Sekuruwe. It will keep them healthy and it will serve them and it will be 24 hours a day and 7 days a week. Thank you, MEC, to come to make this clinic operational, and we appreciate your time.
On her address, Dr. Phophi Ramathuba emphasized the cornerstone role that the community-based care personnel play in building a reliable healthcare system for all.
The healthcare system starts within the community. It's home based carers. The health system starts with the community healthcare workers. Because people are never trying to access baduli kambo meeting yabona. People are never trying to we are saying we must move a step ahead as government. Tabayahuri their job, we are going to upgrade their scope. Blood pressure, cholesterol, because those three are our silent killers. So that blood pressure, you will find our renal unit. What is happening? These days, they are now diagnosed with unyaka dialysis in kidneys. And when you check, it's because people have been chronic diabetic and hypertensive without knowing until they crash the kidneys. Because by the time the kidneys are how they are finished. Because you have been working, that's why the is silent killers. We are up and down, not knowing what gradually it's destroying your organs. So that's why, because we should start by investing on them. And once they can move, that's why this year, we must start by putting them on our personal system and put them on a minimum of 3,500, all of them, and we did that. We did that. So we are still going to do it. We don't need anyone to put a gun on our head. We are saying we understand what needs to be done and the correct thing, and we'll continue to do that. It's not every condition that must be seen by a doctor. We're making a big mistake in most of Africa. That is why because that's where we want to. We are not sleeping. More stuff without investing on that. It's a problem. I can see what senior citizens, they are approaching 50, 60 now. By law retire. When they retire, who are they handing over the baton? It's time for them to hand over. That is why it pains me. How about Arna Chelsea Hira, the new graduates, so you can't be fighting me because I want them to be hired. Because once you hire them now, then you will be able to get them being trained by the best. Because when you don't hire them, but don't mentor whatever, you are going to hire them, but not any mentor. Because it's about Madida fellow searching mentor. So mentoring work on patient care, on nursing care. On nursing care, these senior ones who trained when it was very difficult. Those who taught me how to hold a needle and suture. Those who told me how to progress a woman from the time from 1 centimeter dilatation until 10 centimeter. Look, how do you support a perineum of a woman so that a baby can come out and up guy 10-10? I was not taught by a doctor, I was taught by a nurse, a midwife. That's the point. Now, if you don't have them training the young ones, that's when your system is going to collapse. We need to upgrade and empower our clinics with resources. Because once you do that, very few patients will require to go to George Masebe Hospital, to go to Fort Tracker Hospital. A system that starts by empowering the community. A system that moves to empowering a clinic. A system that moves to empower level 1 hospital, then your Mokopane, which is level 2 hospital, then you can have your 2 tertiaries, Polokwane and Mangwe, running. If you do that, you'll be able to provide quality of care. It's not that we don't know what needs to be done. We all know what needs to be done, if only we can be able to get the money that we are requesting and also get the attitudes that we require. If we are not having that positive attitude, all of us, you are not pushing in the same direction. Others have got their own different agenda. You will not win. As you are really pushing there and there, the danger becomes these systems affect all of us. Plus I must be flying because nako ya mpete. Ha ke tswa mo ke blue light ke better. Koloi ka rola. Ha I rola koloi. The nearest facility in Tatelanga ke yona Sekuruwe. So if I don't fix Sekuruwe, I can die with a medical aid in my pocket. When you are building a clinic, you are not doing it for the community of Sekuruwe fella. You are doing it for yourself. Meetings more. You can die waiting for that chopper of yours to come and airlift you. We have got golden hour here in the system here. Golden hour is the moment you get an accident, you must receive immediate response. If it's not happening, you will die while waiting for that chopper. So I really want for education. Recovery plan, night studies. You will never. Once you lose, that life is gone. It's amen. It's full stop. So that's why Haribereka, my lesson, Haribereka can't tell you I think I would rapporto. Mistake omolomuwe will end up being disastrous. Clinic told me last week, 5 days. Mam Karakwani, it over 7 days. Mara, the way we are fighting, the way we are pushing, very soon. Clinic 24 hours, very soon. We are pushing very hard because infrastructure is not on. The only thing which is missing here, which we are pushing for that, you will see.
We are happy the clinic is finally opened officially by the MEC.
And this is going to help our communities that are around that we're going to serve because they've been walking a distance to go and access health services, which is their right. Today, they are going to get services near home.
Another thing that is making us happy is the commitment that she's making to say by the end of the year she will address the question of staff shortage and to ensure that she appoints. But we know as DENOSA that the stumbling block is in the treasury, but when there are commitments, more especially when now we have seen the advertisement of post, there is hope that ultimately the clinic is going to get a full complement of the staff. Complement should also be given to the staff members who relocated from various clinics to ensure that they open this clinic and ensure that we are taking services to the people in our communities.
Sharon Livhebe, Limpopo Health News, Sekuruwe Clinic, Waterberg District.